We're live.
Well, good evening and welcome to everyone. This is a terrific turnout. We are grateful to Community Boards 7, 9, 10, 11, and 12 for your partnership in this event. In particular, Mark Diller from CB7, Barry Weinberg and Health Co-Chair Edwin Torres from CB9, Cicely Harris from CB10, Nilsa Arama from CB11, and El-Sadr Bueno and Health Chair Steve Simon from CB12. You will hear tonight from three leading lights of the Columbia health community. They will share specifics on how Columbia is approaching the fall semester and the COVID crisis more generally. And they will answer questions that you and many other members of the community have raised. The first speaker is Donna Lynn, who is running our reopening process. Donna is the COO of the Medical Center and a veteran healthcare administrator. She also is the former Lieutenant Governor of Colorado, and before that served in various roles in New York City government. Melanie Bernitz is an MD who leads Columbia Health. As such, she interacts with Columbia students and is in the process now of launching our testing and tracing program on campus. And finally, Wafaa El-Sadr is one of Columbia's most decorated academics, a renowned epidemiologist at the Mailman School of Public Health. Wafaa runs ICAP, which is a leader in the global AIDS fight and now is on the front lines of the COVID battle. Wafaa has provided invaluable guidance to Columbia's leadership from the very early days of this pandemic. We also are joined tonight by one of the most dogged political leaders I've ever seen in a crisis, Manhattan Borough President Gale Brewer. So thank you for being here, all of you, and I'll turn it over to Gale to say a few words, and then she'll start the presentation. We'll start the presentation segment with Donna. So over to you, Gale.
Thank you very much. I'm sorry for my mask. It's in a car, and I've just come from one event and going to another. But I want to say how much I appreciate Columbia University for not just doing this with the dynamic, fabulous Uptown community boards, but also you have been helping us to keep safe on many topics, because information is power, particularly during these many pandemics, and your neighborhood focus has been phenomenal. So I'm here to listen, but also just to say to Donna and to your other magnificent speakers, you know, what is Columbia doing in terms of opening? Because whatever you're doing, I think will be helpful for the K-12 that is really jinxing us somewhat, to be honest with you, in terms of the public schools. And I also want to just say, I'll be listening, because I know you're already doing this, how you're helping to keep our neighborhood safe. So congratulations to everybody, and I look forward to listening. And again, I thank Columbia University, because all of these sessions have provided valuable information, which is so necessary for our communities. Thank you so much.
Well, good evening, everybody. I'm Donna Lynn, and as you heard, I'm up here at the Medical Center, but I've been spending a lot of time at the Morningside campus as well. And I think Gale posed an interesting question, which is, and we call this reopening, but the truth is we have been open throughout the public health emergency. Our essential personnel, whether they were our student support teams, our facilities and security teams, and certainly on the CUIMC campus, we've had thousands of our faculty and staff providing vital healthcare services, but other support services. So reopening is probably a little bit of a misnomer, but we will tell you how the campus has been transformed over the last several months. We have met many of the public health standards that have come out of the CDC, out of the governor's office, and out of the mayor's office. And as I said, we have thousands of faculty who have returned to campus. What I want to do very quickly, there's a lot of slides, but I want to make sure we save enough time for questions, is, as you know, we're in phase 4 right now. And that means that education, including higher education, can resume. And as I said, we've had lots of students on campus. The medical school classes have begun again up here at CUIMC, and many of our graduate students at Morningside have been in residence. We've had a president's task force that meets daily that has worked on how we come back. We've obviously engaged the president, the trustees, and many others in the community to talk about what we plan to do. And we have a reopening plan that is actually going to the governor later this week. And at the end of the day, the governor is, as you know, the final authority on our reopening plan. But the key word in all of this is safety. And first and foremost, the safety of our faculty, staff, students, and the community is the first thing that we are focusing on and what we will focus on throughout. And between now and really next week, because we look at next week as a significant milestone, we are gathering plans from students, plans from faculty and staff so that we understand what this reopening in September actually looks like. I mentioned that our physical plant is a really important part of what we do. And we have very rapidly been adapting our physical plant to conform with CDC, DOH, OSHA, and other standards. And so things like changing some of the physical equipment on the campus, so automatic touchless faucets and flushometers, making sure that we're doing additional cleaning, including electrostatic cleaning, increasing hand sanitizer throughout the campus, and making sure that we're watching all of the spaces as we will continue to do so. And you'll hear from Melanie talk about something called the Columbia Community Health Compact, which is a pledge that we make to each other, faculty, staff, and students, to adhere to many of the guidelines. We've also done a lot with our heating and ventilation and air conditioning systems, because air quality certainly has been a concern that we've heard throughout. And so we've been changing air filters, improving air flows, using different standards in terms of our air quality, and using leading edge technology to make sure that there is a very, very clean and clear air throughout all of our systems. We're running our HVAC systems 24/7. We would normally shut down, but we believe that continuous air circulation is also going to help. And so there are a tremendous number of things that we've done to improve the facilities to the extent that there's concern about transmission through surfaces. We've also added a lot of signage, and you'll hear a lot about how we want to reinforce behaviors. Face coverings are mandatory on the campus. We have guards who are distributing face coverings, and we've got other instructions around physical distancing, use of stairways and elevators and circulation patterns throughout all of our buildings. This is an example of some of the signage that we have across the campus. I myself have toured. I come into the medical center campus every day, and so I've seen the installation of this and at many of our other locations, and been down to Morningside to watch how we're transforming the campus. And finally, this is just a sample of some of the things that you now see on the campus, including some signage outside, decals that enforce distancing. We've introduced a symptom self-checking app that every employee and every student will have to comply with, and complies with now every day, or access to the buildings is denied. So a number of both physical as well as, I guess I would call it, behavioral supplements to what we expect on campus. We've got building readiness checklists that are available on our website so that people can determine, how often we're cleaning, what kind of systems have been installed. So this is not a mystery to anyone. And then finally, transportation. One of the things that we've done to improve the safety of all of our affiliates is to provide additional cleaning on university provided transportation to expand the hours, and to ensure that face covering and reduced density is maintained. I'm going to turn it over to Melanie.
Thank you, Donna, and good evening, everyone. I really appreciate being here with you this evening. As soon as Donna stops sharing her screen, thank you, I'm going to try and pull mine up, see if I can do this right for you. There we go. Great. So We want to make sure when the university reactivates with more students and faculty and staff coming to campuses that we're keeping them and each other and our community safe. And we know this can't be successful unless our entire community participates, and as such, extensive work has already happened to start laying that groundwork. Every member of the Columbia community has agreed to the terms of our Columbia Community Health Compact that Donna mentioned. And this is Columbia's call to action to recognize our shared responsibility for community health, informed by science and founded on mutual respect. And it really recognizes that we as individuals and our university have to operate differently now, and that we all have to abide by that by wearing face coverings, keeping physical distancing, staying home when we're sick, following guidance, and participating in testing and contact tracing. And the university on their part is supporting these by cleaning, communicating, and testing as needed. And abiding by these principles is required by every Columbia community member. We believe this will directly impact the broader community as well, because we are telling our Columbia community members to be here as part of this community, you must abide by this new ethos. And we truly believe that the impact on the community will be wide, because this becomes very ingrained in our behaviors, and our Columbia members really take these behaviors with them off campus. So it'll really enforce everything that's happening, not only on campus, but in New York City and beyond. So as Donna mentioned, face coverings are mandatory in all Columbia spaces, indoor and outdoor, with the only exception being when you're in a private office or a bedroom with the door closed. So we've really gone, I think, above and beyond what the state requirements are around face coverings. We have extensive signage across campus supporting this. Public safety on both campuses will hand out masks to our community members and visitors alike who don't have a face covering. And we're giving these 2 face coverings to each of our Columbia community members, just as a reminder, but they're welcome to wear whatever face covering they choose. The community is also being trained in what we call bystander intervention. These are techniques to encourage our fellow community members to wear their face mask and to wear it properly, as you've seen so many people wearing face masks as chin hammocks or under their nose. So we're really drilling that into the behaviors for our community. In addition, we have a daily symptom check tool. The screening tool you'll see here, which is currently being used by everyone accessing campus. So every Columbia affiliate, student, faculty, and staff are expected to complete the screening questions every day before they access campus. And in fact, they're not allowed to participate or enter campus without completing this daily symptom check. And it really serves as a daily reminder to stay home if you're sick or if you've been exposed to any of the other COVID-19 risk factors. We are linking it to the ID badges and access to buildings. So those who are on campus now know every day to fill in and make sure they get a green pass before they can come to campus. As you can see, it just requires 3 quick questions about testing positive, being in close contact with someone with COVID-19 or having symptoms of COVID-19, and this has actually been updated since my little slide was made, but around traveling to states or coming from outside of the United States. You get a green pass if the answers are no, you get a red pass if you answer yes to any of the questions. So Donna mentioned our testing approach. As we all know, testing is one prong in a multi-pronged approach, public health approach to getting back to some aspect of normal life, both at Columbia University and more broadly. It's a component we add to the other factors, the symptom attestation, the face covering, physical distancing, and all the other changes you've heard about. We're separating out testing of anyone who's symptomatic with those who are being tested through a surveillance program. And we're really fortunate to have been working with some of the finest public health experts and infectious disease clinicians, epidemiologists, statisticians, and modelers to really determine the best path forward for our testing program specific to Columbia and our place in New York City. And as such, I would say our testing approach is heavily, heavily anchored in data and science and epidemiology. The objective of the surveillance program for faculty and staff is really designed to detect elevated campus prevalence above that experienced in New York City. And so it's really going to assess what's happening in our population, and we can use that to adjust all the other measures that we've been talking about. So as we explored the development of a testing program for our resumption of campus life, we used 5 main principles. Effectiveness, what is the stated objective of a testing program? What are we really trying to do here, and how effective can we be? Reliability and validity. We need a test that can obviously detect SARS-CoV-2 with good enough sensitivity and specificity to detect virus during the infectious period. Feasibility, while we know testing has become more and more available, we still need to have a program that's scalable. We have to ensure an appropriate test that has FDA approval, a quick enough turnaround time to be effective, a lab that meets the standards set forth by New York State lab requirements, access to testing supplies and reagents, which we've seen some problems in those, obviously influenced by not only local trends, but national trends. And acceptability, a test has to be acceptable to the population. We know that the nasopharyngeal swab, the deep nasal swab, is very uncomfortable, but there are other methods of collecting specimens such as nasal or oropharyngeal or even saliva. And folks need to be willing to come in for a test, and they need to be able to get through the testing process quickly and efficiently and non-disruptively. And finally, affordability. A program has to be cost effective. Cost, is never the decision maker here, but obviously we have to be able to scale up appropriately and make tests available and so on. So what have we been doing? So as well as spending the last few months analyzing and modeling multiple approaches for these testing strategies grounded in the principles I've described, we've been looking at the strategy that works right for Columbia right now. And we actually put this into effect on June 22nd. And the first step is a gateway test for every Columbia affiliate. That means every Columbia affiliate who's returning to campus, who's not been on campus, is required to get a test before they can return to campus. And that is going to remain true for every Columbia community member returning in the fall, be they faculty, staff, or students. So everyone will get a gateway test. We started doing this, as Donna mentioned, when we started reactivating on June 22nd. And so far, I probably should have gotten the exact number from Donna, but I think over 2,300 gateway tests have been performed so far. We've been doing this in partnership with ColumbiaDoctors and Columbia Health. We're tracking the results, and we're working on communicating those results of surveillance testing. We will be transitioning to a different testing mechanism in the middle of August as we scale up. So then as we move forward through the fall for faculty, staff, and many of our graduate students, the ongoing testing is going to use a random sampling approach. And this is going to allow point in time evaluation on a weekly basis of a percentage of our population, and continuing to do that at multiple time points throughout the semester. As I mentioned, that's going to let us look at the campus situation. And if we see the situation trending in one direction or another, we can adapt in real time and make changes both to the frequency and the sample size. For the students in the dorms, they have a different testing approach because they're living in a congregate setting, which may carry some higher risks of transmission. Initially, they'll be tested weekly, but similarly, based on the results of that, the situation on campus and the situation in New York City, we can then adapt the testing strategy as we need to. And then finally, any campus affiliate who is symptomatic, as any person who's symptomatic, should get tested immediately. Anybody identified as a close contact of a known contact will be asked to quarantine and offered appropriate testing as well. So I mentioned contact tracing. Obviously, you need to pair testing with the ability to contact trace, because that really is the important strategy to prevent further spread of infection if someone is identified. So any individual who's diagnosed with COVID-19 is interviewed and asked about people with whom they've had contact during the period when they may have been infectious. These contacts are then notified about their potential exposure without revealing the identity of the person diagnosed, and they're asked to quarantine for 14 days and given guidance on how to take care of themselves and prevent transmission to other people. So we are actually have set up some internal contact tracing, working in collaboration with New York City and their test and trace program, so that we can really assist in this process. And then finally, just some details on our monitoring plan. We've set up extensive and robust dashboards that look at metrics that we receive every day from the City Department of Health, from the medical center, as well as our own internal data sources, looking at the overall incidence of COVID-19 in New York City, diagnoses, hospitalizations, et cetera. And then through our own testing surveillance, we'll be able to assess what's happening on campus, as well as tracking adherence to our face covering mandates, physical distancing, and so on. And then we use these metrics to look at the campus situation. So we'll be able to look at the thresholds and say, okay, things are changing. What do we need to do? And that way we can then adjust parameters. So if we see things just changing a little bit, we can reinforce face covering, change testing frequency. If things are progressing, we can really start to put in more restrictive measures, leading all the way to the move back to virtual instruction and suspension of all non-essential campus operations. So it really feels like a difference, I think, as you could see from these levers, whereas March was kind of the shutdown, the light switch flicked from the on to the off switch. We now have the ability to really use much more subtle adjustments as we see the situation change. And this will really ensure that not only is Columbia safe, but so are our neighbors. So I'll pause there. I appreciate your attention. I really hope this highlights some of the strengths of our testing and tracing programs and some of the measures we have in place to keep our community and the broader community healthy.
Thank you very much, Melanie and Donna and others, for the opportunity to address you tonight. And I hope you can all see my slides. What I'm going to do today, what I've been asked to do, is to talk a bit about community transmission overall of this virus, and also about what is the COVID-19 related research that's ongoing now at Columbia that's might be of interest to many of you on this call. So as you all are likely aware, or I'm sure you're aware, is that the way this virus is transmitted is that it's transmitted from someone who's infected on the left-hand side here, who has the infection in their respiratory tract, and to a person who's susceptible on the right-hand side. And the main methods, the main way, the main route of transmission is through what we call droplets. And these are particles that people expel from their mouth or nose when they cough or sneeze and sing loudly and so on. This is the major route of transmission of the virus. It's thought that also there's potential transmission by fomites, and fomites is a fancy word for surfaces, different surfaces. So if you think about it, the reason why we advocate strongly for the use of masks and face coverings is to protect from droplet transmission, as well as the distancing is also to protect from droplet transmission from one person to another by increasing the distance between the two people. And then all this cleaning and disinfection and so on, the surfaces that Donna talked about and Melanie talked about, that's also to disinfect the surfaces. And then there's some who believe that smaller particles, what are called aerosols, also may play a role in transmission of this virus. Now, just to give you a sense of what we do during different epidemic phases and the response we need to do. So as you're well aware at the beginning, there's the introduction of a new germ, a new virus into the community. That's followed, if it's not detected early and addressed very early, it can go to the phase of localized transmission from one person who has the infection to their contacts. And then if there's ongoing transmission, further transmission, then it goes into the amplification phase, where there's a lot of transmission from a lot of cases to a lot of contacts. And at that point, it's very difficult to do the contact tracing that Melanie mentioned. And then if you were successful with some measures that have been taken in place, then we can get to reduced transmission and then hopefully to suppression of the virus or elimination of the virus. So if you think about it, in March and April, New York City was in the amplification phase, and we're now in the reduced transmission phase where we're working hard towards suppression of the virus. So what are the ways to control the outbreak, and what has been utilized in New York City and around the United States and around the world? So first, there's a group that's called the population interventions. These are public health measures that are at a population level, includes some of the directives like limitation of mobility, stay-at-home directives, restrictions on domestic or international travel, closure of schools and universities, as well as limit the size of aggregation or congregation of different people. Now, in addition to these population interventions, we also have individual interventions. You heard a lot about those from Melanie and from Donna, the physical or social distancing, the face covering and mask wearing, hand washing, sanitizing, cough and sneeze etiquette, disinfection of services, stay at home if you're sick, the isolation of any cases of COVID-19 and quarantine of contacts. So what we've been doing in New York over the past several months has been a combination of these population interventions as well as these individual interventions. There are also potential biomedical interventions like use of testing. When we talked, Melanie mentioned about the use of testing as an adjunct to other prevention interventions. And there's the potential, of course, for vaccines and drugs and antibodies down the line. So in essence, what we have now at our fingertips, we don't have a vaccine, we don't have a biomedical vaccine, but we have what I call a non-pharmaceutical vaccine. If we're able to use all of these measures and do them well, as New Yorkers have done over the past several months, we can actually make a dent and control the spread of the virus. So what's been happening in the US and what's been happening in New York City? And in brief, in the US, we've had this two-peaked mountain. We started out with the increasing cases in March and April, and then we reached a high plateau in the US overall of about maybe 25 to 30,000 new cases per day. Unfortunately, we were not able to bring this peak down to the baseline here. So we continued at this high plateau, and then we've had recently the upsurge in new cases, and now we're plateauing at a higher peak of almost 50 to 60,000 new cases in the United States. Now contrast that with New York City, where we've had the New Yorkers, we've had enormous success. You can see here in this curve, the initial rapid rise in the numbers of cases in March and April, and then the slow but steady decrease in numbers of cases to the point now where in New York City, we have, as I said, we're in the suppression mode of the virus. And this is good news, and obviously there's a lot of effort that needs to continue so we can sustain this viral suppression through the means that I described to all of you. And we, all of us at Columbia, are obviously very committed to maintaining the success that has been achieved in our city thus far. So one of the important things we keep an eye on, all of us, is where are new infections happening. And there are a lot of data available, as Melanie mentioned, and we keep an eye on where the new infections, where the cases are happening in the city, in which zip codes. You can see here in this map. We can have a finger on the pulse in terms of what's happening in our immediate community as well as what's happening in the city. But in addition, we also need to keep an eye on what's happening in the US overall, and that's why there are in place these restrictions on people coming into New York City from hotspots and the need for such individuals to quarantine. So now I'm going to switch and talk about some of the COVID-19 research efforts that might be of interest to all of you. So at Columbia, there's a lot going on in terms of COVID-19 research. There are a total estimated now of 279 projects of very different types of projects that are ongoing. And this is really good news. There's been intense mobilization to move forward with many of these projects, and many of them are, of course, in partnership with the community. So there's a lot of work to find new ways to diagnose and do testing. There are also projects on identifying or defining or measuring, evaluating new vaccines and new treatments. I'll tell you about some of this work. There's also work, epidemiologic work, about how do we map the progress of the virus and the epidemic in our community, both in the city as well as in the US and globally, through modeling and other kinds of studies. And then, of course, development of new devices and equipment, and then also a huge effort at trying to measure and influence community impact and to flatten that curve, meaning to keep the virus under control. So I just wanted to tell you about two research sites. These are two ICAP supported research sites that might be of interest to all of you. There's one site that's situated at the Harlem Prevention Center. It's 125th Street, a storefront site that's been in the community for decades, has long-standing relationship with community organizations and community boards, and also a site as well in the South Bronx, the Bronx Prevention Center, similarly with decades of experience and connections to the community where it's situated. Now, what are Oh, I'm sorry about this. Now, what are the efforts that are going on now at the Harlem Prevention Center? I thought that might be of interest. There are lots of studies that are either in progress or in development. There's a study looking at the immune response in people who've recovered from COVID-19. There's also a study of looking at antibodies. These are produced by the immune system in a person who's infected. And there's an effort to look at whether these antibodies, if they're given to a household contact, whether they can prevent COVID-19 in such individuals, and that there are plans to also participate in one of the vaccine studies that's coming down the line. In addition, there's a study also being done to look at COVID-19 prevalence overall in the community. What about in the Bronx Prevention Center? Similarly, there's also the study looking at the immune response, the monoclonal antibodies, and there's several vaccine studies that are now either about to start or are in development. The AstraZeneca vaccine, there's a Janssen vaccine. There's also a Merck a treatment study that's also being planned, as well as the prevalence study that I mentioned to you before. Very importantly, of course, the whole purpose is to reach and achieve and maintain the community impact in terms of suppression and control of this virus. And the faculty of students are really mounting efforts in a lot of different ways to offer legal assistance, assess economic impact of the vaccine, advocate for social justice, improve accessibility to resources and treatment, and try to work on, particularly on mental health issues that we know are profoundly important in the context of this epidemic. And then there are lots of concurrent projects that are ongoing now. They're really looking at some of the impacts of COVID-19 on the community. We are involved now in getting off the ground at ICAP a survey among older New Yorkers to look at the impact of COVID-19 on the lives of this group of individuals who are over the age of 65, to be able to understand the impact not on their health as well as their well-being, their mental health, sense of isolation, their food security, and so on. And you can see also several other studies that work that's ongoing that's looking at the impact on the community in terms of poverty and other hardships, as well as looking at the effects, of course, on healthcare workers as well, which is, of course, of great importance as we move forward to determine the impact of COVID-19 on the communities where we are situated, as well as on our own population, our own healthcare workers. So I'll just end with the slide, and it just brings everything together. And the mantra is that we want to be safe together, all of us at Columbia and with all of you. This is, the university is part of this community, and we believe that it is through efforts that are being put in place on campus that hopefully we can sustain being safe together. There was mention of the Columbia Contact, the facility enhancements that Donna mentioned, the signage, the hand sanitizing, the symptom check, the availability of face coverings and masks, the physical distancing signage, and then the programs that Melanie mentioned, in particular, the COVID-19 testing for our community members, as well as the contact tracing. Thank you very much, and I'll stop here and hand it back over to you, Donna.
Thank you. Thank you, Wafaa and Melanie. And we have a number of questions. And one of them popped up as Melanie was talking about the testing results. As she said, there have been over 2,300 tests that we've done for faculty, staff, and students since June 22nd. And beginning next week, these will be posted weekly on our website so that everybody can see what's going on in the community. We think the transparency to our, not only our faculty, staff, and students, but to all of you is a critical part of what we should be doing as we bring back more students and more employees to the campus. So I'm gonna go to some of the questions that we've gotten through chat, and I would encourage you to submit the questions, because I'm sure they're going to be far-ranging. We have one question which relates to testing. I'll ask Melanie to answer, which is how often will the various constituents here at the university be tested, whether they're undergraduates, graduates, and faculty.
Thank you. So initially, everyone will have the gateway test. So for our students, they're actually getting that test the day they arrive on campus. So for the undergraduates, before they can even pick up their room key, they will get tested, and then they will actually quarantine in their room until their test results are available. So we're really ensuring that we catch everyone on day one. Similarly, our faculty and staff will get tested before they return to work in the few days before they return. Then for the students living in the dorms, initially they will be tested weekly. This decision on weekly testing is based on the data and the evidence and modeling work. I know there's a lot of modeling studies that have gone on out there, but what our modelers did was use our Columbia environment, our measures on campus, and the New York City status currently to put that in place. And what that allows is flexibility in that testing frequency, dependent on what is happening in the on campus and the surrounding community. So that's for all of our undergraduates and any student living in a dorm-like setting, the initially weekly testing. For the remainder of our population, we are sampling initially 5% of the population per week. So we'll be doing a lot of testing. We won't capture everyone every week, but again, the reason being to really assess prevalence, given what's happening right now in New York City with incredibly low prevalence. Thankfully, this allows us to just do a check of what's happening. And obviously, if the situation changes, we can change that frequency and the size of that sample.
Great, thank you. So we have a question that I'm going to tackle and ask Wafaa to add in a little bit. It is actually a statement, but I will amend the statement. So the statement is the rationale for asking faculty to consider in-person testing in the fall is that it would enable international students to enter the country. And actually the rationale for asking faculty to consider in-person testing is, quite frankly, the richness of the in-person experience. And in fact, in some classes, in-person testing is essential to the learning experience. Think about things like architecture. Think about, obviously, up here on the medical campus, where we are engaged in clinical rotations, and in-person testing is really essential to the richness of the clinical experience. And I'm sure there's lots of other examples that I could cite about the benefit of in-person testing. In-person teaching. We also think it's important to have faculty and staff on the campus when students are on the campus, because it creates, again, a sense of community. And as Melanie was talking about the compact, part of the compact is a two-way relationship between the university, the students, faculty, and staff, and we're going to depend on each other to enforce it. So there's no connection to what was and is no longer the requirement that the Trump administration attempted to have to make international students who were going to be taking only online courses to return to their countries. So Wafaa, do you want to add anything to that?
No, I think you stated it beautifully, Donna. The richness of in-person instruction is well recognized, and I think the goal is to enable our students to have the opportunity to get the very best possible instruction. Thank you.
Thank you. We have another question, which is, how will the university protect those of us who are older adults and live nearby and are frightened of getting COVID from students without masks, gathering in large groups and outside bars and in our parks? So Wafaa, I'll turn to you.
I think we are, I'll address this and others can comment. I think we are taking the Columbia Compact very, very seriously. And it's a commitment that every single individual who's coming back on campus will make and has to make, as well as a commitment by the university as well. Not only this, but there also will be repercussions for individuals who don't adhere to this, because we realize this is a very serious issue, and it's not an elective where someone can decide they'll do one of this and one of that. This is a very serious commitment, and we're doing everything possible to make it possible for our community to adhere to the different parameters that I shared with you, as well as also this will have teeth. We will be able to then, people who don't follow these recommendations, there will be repercussions for them, whether they're student or faculty or staff. I think Also, it's important thinking about people who feel vulnerable in the community, and I totally understand that. One can also protect oneself by trying to adhere oneself with the measures, like having the face covering on the mask all the time, wear it appropriately. Physical distancing is absolutely critical. Those 6 feet can make a huge difference. So I think we can make choices also as community members in terms of avoiding crowds and wearing our own face covering and so on.
Great, thank you. And I would just add that the compact does speak to the fact that the students and faculty and staff also have a responsibility when they're off campus. It's not just on the campus, where we will be monitoring and having ambassadors who are going to enforce the wearing of face masks. And of course, the governor has made the wearing of face masks a requirement. So those city and state public health requirements that exist around distancing and face coverings will be enforced. And as Wafaa said, we have in process something that really requires that you would have to leave the community, the Columbia campus community, if you are found to be in violation of those measures. Shayla, I'm going to actually, you're not supposed to be speaking, but I'm going to turn on you because we have a question that's more in the political and government domain, which is a question about supporting things that would help the infrastructure and the health of the neighborhood, including the New York Health Act and the eviction moratorium and other things that might help the community thrive in this difficult time.
Well, we have, I mean, there are so many awful dimensions of this pandemic, but I think one of the amazing dimensions of it for many of us has been the richness of the contacts that we've had with the community over the last few months, and the different ways that our relationship has developed with many of you. I mean, we have a loan program that we've set up that's supporting local businesses that are in the process of reopening. We've done a whole series of public health related and other pandemic related issues, town halls with the borough president. We are constantly, we're in the process of a long, I mean, open-ended campaign to raise funding for some of these kitchens and food pantries that are in overdrive and will presumably be even more stressed as the unemployment benefits dry up. So we have, as the campus reopens and our facilities in a limited way come back to life, I think there will be more opportunities from that. I think there was a question about the health center at Jerome L. Green. We're thinking about how to adapt that to pandemic-related response, and I think we're open for business, right? In terms of working with you all and any organization in our the greater neighborhood of Northern Manhattan to help the community get through this and help us help you get through it in whatever ways we can. I mean, New York is in better shape than it was a few months ago, but it will remain one of the hardest hits, if not the hardest hit region in the country, I think, and it will take a long time to climb out of this. So we're just really committed in every conceivable way, not just through our academic resources, but whatever resources we can muster.
Great, thank you, Sheila. I'm sorry to put you on the spot. You're I have a question about back to testing and to Melanie. As you heard, the frequency of retesting for people not residing in the dorms is going to be based on a sample of 5%. And Melanie, could you talk a little bit about why 5% and not a bigger number?
Sure. It's really based on looking at what's happening with the prevalence at a specific point in time. And Wafaa, please correct me if I'm getting the details wrong, because you know about this. So at the times of low prevalence and just looking to see what's happening, that gives us, and we tested the power on these models with the sample sizes. We're looking at power of about 99% or higher to detect with accuracy the prevalence of what's going on. It is not, we are very aware that testing 5% of the population may not detect every infection, but enough for us to be able to do a check of what's happening. And again, know that where there are potential clusters or outbreaks or those with symptoms, those are going to be isolated and recognized separately. So that's where the 5% comes from right now based on what we're seeing. But again, as I keep mentioning, and I know I keep saying the same thing, it's saying, well, the models are so flexible that depending on what's happening, you can increase the size of the sample size or the frequency of the testing approach. Wafaa, did I get it right?
Yes, you got it perfect right. And I think it's really important to keep reminding everyone that the approach to testing and the frequency of testing, et cetera, all of that is really dependent on what's happening in the community. And we're keeping a very close eye on the epidemic in our city, in our community, and we'll adjust accordingly, either increasing the testing or decreasing the frequency, all depending on the data.
Great, thank you. There was a question which we will do, which is, can the complete suite of signage be shared? Yes, it's actually available on our website, but we'll make sure that we post that. We did get some questions ahead of time, and so I want to turn to some of those because people were thoughtful about preparing for this. And one of them is about flu season and whether or not, what we are doing in terms of flu shots. And do we expect that the COVID season is going to be enhanced partly because we're going into a flu season as well? So will we see a more severe incidence of COVID as we get into flu season?
I can start just in terms of how we're approaching this for students. We realize that there potentially are complications, and Wafaa can speak more around the epidemiology and about the overlap between flu symptoms and COVID-19 symptoms and the complexity of that. So the more we can reduce the burden of influenza on any of our communities, the better. We have always been huge fans of influenza vaccination and understanding what that does to reduce burden of disease. We host for our communities flu fairs to encourage vaccination. We're actually taking it one step further this year, and we're mandating flu vaccination for every student on campus this fall with a deadline of the end of October, and we'll be providing those vaccines to them unless they have a valid medical or religious exemption. But we will have a far higher rate of influenza vaccination for our student population. We continue to strongly encourage it for our faculty and staff and make it easily available as well, knowing that that can then again reduce the strain on healthcare systems and reduce the potential overlap between flu and COVID-19 symptoms.
I'll just add a few. I'll just add a few, just a few comments here. And we need your help to get more people in the community to get the flu shot. I mean, I think it's been an uphill battle to get a high uptake of the influenza vaccine, and we're very hopeful, and I'm very hopeful that because of the threat of confusion of COVID symptoms and influenza symptoms, that we will get high coverage in the Columbia community. But I'm hopeful that we'll get high coverage for the overall community, because that's in the best interest of everyone, particularly people who are more vulnerable to complications of flu, like, for example, the elderly and people with underlying conditions. I think in terms of what's going to happen this winter, it's no one knows the answer to that. I think it's, as you know, we call it a novel coronavirus, means it's a new virus. We're not sure whether it's going to be seasonal, meaning it's going to come back in the winter or not. There's worry that because it is similar to other coronaviruses, like the common cold viruses, they tend to be more in the winter. And I think that's the reason why we want to have everything in place, flu vaccines, but also to maintain these protections as much as possible over the winter season. But nobody knows the answer whether there will be a seasonality with this novel virus.
Thank you both. I'm gonna turn to Melanie to talk about quarantining out-of-state students. As you know, the governor has a restriction, as do other governors in the adjacent area, about how out-of-state arrivals have to be quarantined. Could you talk, Melanie, a little bit about how they will quarantine in our dorms or before they arrive at our dorms?
Absolutely. We've been tracking this very closely. And so we have been sending out messaging to our returning students, both graduate students and undergraduate students, about the various ways to ensure they arrive safely to campus. So we actually have sent out messaging that encourages students, if they're able to get a COVID-19 test before they even travel back to campus, so that if they are diagnosed and test positive, they stay home and recover before they come to New York City. We're also talking to students about reducing their activities in those couple of weeks before coming to campus, again, to reduce burden. But acknowledging that there are many states on the New York State travel advisory currently, and that our students are required to quarantine in accordance with the state guidance. And we take that very, very seriously. So they can do that in a number of ways. They can quarantine in a non-hotspot state for 14 days prior to coming to New York, or with a family member in New York if they have one. Some of our families are choosing to come to New York early and quarantine in a hotel, for example, for 2 weeks prior to moving in on campus. But many of our students aren't able to do that, so we will support their quarantine on campus. For our undergraduate students, that means they will quarantine in their dorms. We will be delivering their meals to them so that they can fulfill the requirements of quarantine. And similarly for our graduate students, if they quarantine in our housing and residential, we have quite explicit guidance on how to quarantine safely, what that means. It's not a partial quarantine, it's a full precautionary quarantine, how to ensure they get groceries delivered, what support we can provide them with during that time period. And the other piece to add is even these students will get that gateway test. So we will know before they start their quarantine if they test positive, and then obviously we'll isolate them appropriately if they do test positive.
Thank you, Melanie. We have a question that was previously submitted about how Columbia will be educating its students before they arrive on campus, particularly those groups that Melanie just mentioned. And we do have a series of steps. In fact, we already took the first step educating students just this week, but there have been student forums that we've conducted, but I'll ask Melanie to talk a little bit about the process before people come to campus and literally the day they arrive on campus.
Yeah, thank you, Donna. So our students, the new students, obviously all new students go through an extensive orientation before they arrive on campus, and that's a lot of elements. You will know that students have to meet before they come on campus, but they also have an additional piece around COVID-19, around the compact, around the community responsibilities, around the face coverings, and so on and so on and so on. For our returning students, they also have to complete a pre-orientation model around COVID-19 and the changes that are happening to campus. This is then all paired with their signing of the Columbia Community Health Compact that really attests to their willingness to abide by these new rules of engagement of being a student at Columbia and part of our community. The education will then be ongoing once they arrive on campus. As I say, on that first day on campus, the first thing they're going to do is get a COVID-19 test. For many students, they're then going to quarantine. So they're going to really be getting a lot of information around how to do this. We're engaging through all levels of folks who are student facing. So at the school level, they have wellness deans and student affairs folks who are engaging with them. At the university level, University Life is doing extensive programming around this. And we're really engaging their peers as well, knowing often for students, hearing this not from an administrator, but from one of their peers is far more impactful. So really having peer ambassadors go out there and be trained to talk to students about why it's important to behave this way, really encourage all these preventive behaviors that we're talking about. So it's just going to become part of the everyday life from before they arrive on campus to being on campus. And just as we've shown you through the pictures, just by being on campus, there are minute by minute reminders around COVID-19 and what you need to do to protect yourself. So I think it's a pretty extensive program for student education.
Thank you, Melanie. We have a question. Will Columbia specifically address how Mount Sinai Morningside will be provided with all equipment, supplies, staff, and capacity necessary to handle a spike in the COVID transmission cases? And since I work at the medical center, I can address this one. This is not Columbia's responsibility. It is the responsibility of Mount Sinai, as it is Columbia University Medical Center and NYP's responsibility. So the governor, as a condition of those facilities being able to begin performing elective surgeries in June, had several requirements, not only around some of the public health indicators that Wafaa mentioned, but around the supply of PPE. So any hospital is required to have a 90-day supply of PPE, or they could not reopen. Hospitals are also required to have excess capacity, both ICU capacity as well as regular medical surgical bed capacity. So all hospitals have done that work. And so even though Mount Sinai is adjacent to the Columbia campus, it's not necessarily true that a student or a faculty member would end up or be referred to Mount Sinai Morningside. In fact, they might go in other places in the city or in fact return home. But those hospitals are each responsible for making sure that they have adequate supplies, staff, etc. In fact, one of the things that we're doing now, at least at NYP, is cross-training staff, so that where we have shortages of ICU nurses and professionals like respiratory therapists, that we have cross-trained people to be prepared should there be a surge. Okay, I have another question on contact tracing, and it is, are we going to use an app to do contact tracing? And maybe a little bit more information about how contact tracing is done vis-a-vis the city. Wafaa, do you want to take that?
I mean, I think it's fair to let Melanie start, and I'll add.
All right.
More
Okay,
closely involved.
We'll do our usual tag team here.
Yeah.
No, so absolutely. So as we set up our contact tracing program, we're looking at all ways of approaching this. So obviously, you know, the initial is the manual contact tracing that is done. The app that I showed, the Reopen CU app, is not in itself used for contact tracing, but the university is using whatever technology we have to assist in contact tracing efforts. So we will be able to use our ID system to do downloads from swipes to see what buildings people access. We're also able to download through our Wi-Fi hotspots, and I apologize, I'm not a techie person, so if I'm naming this wrong, but you can see, like if I'm on my computer, you can see what IP address I'm logged into, and you can also see what other IP addresses, what other people are logged into the same Wi-Fi router as me, and we can actually look at the time that we're all engaged in the same and use that to assist with contact tracing. We continue to work with various partners to look at the use of other technology, app-based technology, and its impact on contact tracing, and would certainly look at that when it has become well developed. I think what we're learning with our contact tracing approach is that we're pretty nimble, and that, you know, knowing that we get access to results really quickly, can get right onto the contact tracing within our community and really minimize then any further exposures. Wafaa?
And I also want to remind everyone of something that Melanie said in her presentation, is that the close partnership we're establishing with New York City and their test and trace program, they're of course responsible for all the contact tracing for all the cases in New York City, which is a big burden. So I think they welcome the collaboration, that we will be working hand in hand to assist and to enable very rapid contact tracing of any cases that occur amongst our affiliates. So actually that also is also an additional advantage to the community overall, is that there will be very rapid access to the results of the test, as well as very rapid contact tracing that's done and acted upon as soon as a case is identified. So I think that's also an additional advantage to this program.
Great, thank you. I want to acknowledge one comment that we got, which is actually the opposite of what we're trying to convey, which is someone feels that this is maybe scaring them about what will happen. And I think our intent is to demonstrate that we've put in so many safety measures already. And I have to emphasize, there are 9,000 people who we have showing up to work at both at the Morningside, Manhattanville, and CUIMC campuses. 9,000 people. That's a significant number, and they've been coming to work every day and going through the safety requirements that we've specified. And as you heard from Melanie, that testing number is significant. And if we had any concerns, we would be advising not only the faculty and the staff and the students, but the community at large. And again, you'll be able to see that information on the website. And you heard from Melanie the steps that we will take when we inevitably will see a positive case, which we haven't seen. So I want you to be assured that not only are we using testing and tracing to monitor what's going on, but we're also putting in place measures that are extraordinary, from our HVAC to all of the cleaning and so forth. So I want to turn to, there's a series of questions and they connect, which is about students. And that 9,000 people that I just mentioned, I will acknowledge the overwhelming majority of them so far are faculty and staff, and some graduate students, which of course are more mature than 18-year-olds. And so I'd turn, and I'm happy to contribute as well, but I'll turn to Wafaa and to Melanie. Melanie's runs student health, is to talk a little bit about how do we really think we're going to control or influence the behavior of the students based on peer pressure, based on simply, once I get, maybe I'll behave when I'm on campus because there's security guards and there's all kinds of other people who are, touching their face to show the mask, the importance of mask wearing, or reporting me or whatever. But how do we deal with the maturity level of the students? And we should acknowledge that several students spoke out in The Spectator and said, I'm not going to pay any attention to it. So a tough one, but we have to answer it.
I think it's a tough question, but it's the right question to ask. And I think we all acknowledge that this is not easy. And even, we can say we expect you to do this, but do 18 and 19-year-olds really do what the grown-ups tell them to do? So I think we're very aware that this is challenging. The first piece is that's why not every student was invited back. The population is reduced so that we can really reinforce this and manage these expectations with a smaller population. So not many schools invited back their entire student population, and we did not. And that's one of the reasons why. I've been on many of the webinars that have been given to students at the undergraduate and the graduate levels by their deans of students, where they're really talking about the expectations. And we're taking this really seriously. And I've heard deans of students say, we won't tolerate this behavior. It's literally one strike and you're out. Obviously, there's varying levels. If you forget your mask when you run down to the bathroom, okay. But if your behavior is really putting people at risk, it is not going to be tolerated, and you're not welcome to remain in this community. And I do believe the university at every level is taking that very seriously. And that's not only about accountability on campus, but off campus as well, because we know that our campuses are completely intertwined with the community, and that we expect our students and our faculty and staff to be ambassadors of our university, and they reflect all of us. So we're taking it seriously. We know it's challenging, and that's why so much work is going to go into this ongoing messaging. And these students who say, I'm just not going to do it, I think are going to see the negative consequences if they really kind of follow through on that. So it's going to be a tough battle, but I think we're ready to meet the challenge.
And just to add to what Donna and Melanie said, I think peer pressure can be negative, but peer pressure can also be positive. And I think we are working very hard with different student communities to identify champions amongst the students, ambassadors, sometimes they're called, or champions that will really embrace what we're just talking about today and will be champions amongst their peers. And I think the best way to reach young people is through their own peers. They'll listen to them. They're less likely to listen to me and they're much more likely to listen to peers. I've learned that in my whole career is you have to bring peers so they can influence their peers. So that's what we're aiming to do, is to generate a community of students that really believe in the importance of what we're doing here, both within campus and outside the campus. And also that there are repercussions, and that's really important. The repercussions for not adhering to some of these requirements. I have to say, when I walk around and I live in the neighborhood of Columbia, and sometimes I see it's not the young people who are not adhering to face covering and mask wearing, to be perfectly honest with you. And I think it's a problem that is pervasive, that people can become complacent, and that's not going to be acceptable for the community of students that are coming back to Columbia. But it's going to require very hard work. And we need your help as well. All of you are in the community to guide us and telling us what works, what doesn't work. It's a partnership. Nobody has figured this out completely. We're all working very hard to achieve the same goal. And your ideas are genuinely welcomed.
I would say, sorry, can I just add one more point to that? Students didn't like being sent home in March. And I think our students have a different kind of moral investment now with returning. They want to be able to be on campus. This is the students who are invited to come back, because not all students have been invited to come back, but those who are coming back want to be here and want to be successful. And I think that's going to help reinforce these behaviors, because they know the consequence of not following these behaviors will be going home again. Thank you.
We had a question about why is Columbia having classes in person when Harvard, one of our peer institutions, is doing everything online. And I will tell you that one of the things that we did do is we watched what we called our urban peer institution. So it wasn't the University of Iowa that we were looking at. We looked at large cities like Chicago. We did look at Boston. MIT, by the way, is having in-person classes, even though Harvard is not. We looked at Johns Hopkins, NYU, Penn, Yale, again, all urban peer institutions. And that, as you know, the East Coast being hit by COVID earlier and harder than the rest of the country. And all of them are bringing students back to campus for in-person classes. They are limiting the size of the classes, so a large lecture will probably not happen. We have reduced capacity in all of our classroom spaces, put chair covers on, to ensure more physical distancing. And importantly, undergraduate housing will be all single rooms, so there will not be any kind of gathering. I mean, they can gather in other places, but they will be able to quarantine or just keep themselves self-contained in the dormitories. And that's very consistent with all of the other institutions that we looked at.
Donna, maybe I can add something, if you don't mind, is that there's one comment about the university fully reopening. I don't think that's what's really we're talking about. And maybe if you want to address that, or I can address it.
Go for it.
Yeah, is that clearly we have it's been a slow process of people returning to campus. It remains that a staff that can do their work effectively and faculty that can do their work effectively virtually, or who have any constraint, health constraint, or any life constraint, whether it's elder care or child care, they will continue to do their work, and they can continue to do the work virtually. So that is certainly an option there. There are graduate schools at the university who are not, most of they will do kind of a hybrid approach of some virtual, some in-person teaching as well. So I think it's a mistake to think that totally everybody's coming back to campus. We're being very careful. And as Melanie said, again, not all the undergraduate students have been invited to come back, because we want to continue to maintain a certain density, a threshold below which we want to maintain our density on campus.
Thank you. We have a question about testing, and I mentioned that we have upwards of 9,000 people on the campus, but we gave you a testing number of 2,300. So the question is, why have you not been able to test everyone? That's not the case. And how do you expect to test all incoming students once a week? I'll just say on behalf of the Medical Center campus, where we do have thousands of people, we did not have to go through testing because we've been here all along. The new testing requirements started for new faculty and staff being reintroduced into the community. Had been gone for a certain period of time, effective June 22nd. But I'll turn to Melanie to talk about how she and partly me are going to manage the testing capacity when we have incoming students arriving generally, but not exclusively, within a week.
Right. So we have been able to manage the capacity of those who have been returning to campus to get to the 2,300 number, but we are expanding to a larger scale testing operation with capacity to potentially do about 1,000 tests a day if we need to for our community to get through that. And so we will be able to do the testing, the weekly testing as needed, just using what we call, we build it on the pod, the point of dispensing model that we've worked with the City Department of Health on in the past, so just how to do rapid access larger scale testing. So we have the model ready to scale up. We just haven't had the population on campus needed to do that just yet. But when they come back, we are ready to be able to address that.
We have a question about, we've had a couple questions about how many people are going to be returning to the campus. And I'll be frank that we are collecting that information literally real time right now. So we are trying to find out what students will be taking classes in person, and then what faculty and staff will be returning. And I suspect by about a week from now, we will actually have that number. But we expect it to be significantly less than what the campus would look like. And I don't know, Melanie, if you have any additional information about who you think is going to be returning.
Yes, so we're obviously getting the exact names and details of those who are coming back, but the early estimates across the schools for different schools were showing anywhere between 40 to 60% of their usual population. I can tell you for undergraduate students, housing is usually offered to 100% of them, and it's been offered to less than 60% of them on campus. So we know it will be a significantly reduced numbers. Add to that, Columbia has a large proportion of international students. Unfortunately, many of our students may not be able to get back to campus. So it will certainly not be anywhere close to full density.
Great, thank you. We have a question about N95 masks and providing them to people who are considered high risk. Wafaa, do you want to take that? I have a point of view as being on the medical center campus, but let's hear the public health side of the N95 mask versus either the Columbia provided mask or what I currently wear, which is the traditional surgical mask.
Yeah. I think the recommendations are for people who are not involved in medical procedures, particularly those that aerosolize and create a lot of droplets and aerosols and so on, is that for individuals who are not involved in these procedures, is that it's completely adequate to wear a face covering, a 2-ply face covering, or a surgical mask. Most importantly, actually, is to wear it all the time and to wear it right, meaning that it has to cover the nose and go over the mouth and under the chin. But the recommendation is for everybody, essentially almost everyone, to use the 2-ply face covering or a surgical mask.
One of the questions that has been asked was around the risk mitigation plan and the various stages, Wafaa. And I know also situationally, what we've developed are some scenarios that would identify what would happen. And I think, Melanie alluded to the fact that when we shut down, it was a very rapid shutdown, and that was disruptive in many ways to the students themselves. But if someone is notified that someone has tested positive, for example, in a classroom, could you describe what the process is after that? Wafaa, sorry, looking at you.
Sorry, I can't tell.
Okay.
Yes, yes. I think obviously if that person is tested through us and we know the result is positive, or through another means tested through another testing site, is that we will be aware that the individual is positive, and immediately, of course, that individual would need to be isolated as required based on the CDC requirements in New York City. Then I think the contact tracing team will go into action. And I think what's really important is to then determine who was in close contact with this individual. And it's really important to remember the word close contact. That close contact means having been in contact for more than 10 minutes at a distance of less than 6 feet. And as we had just mentioned, in most classes, we will maintain a physical distancing of at least 6 feet. So it's quite possible and likely that most individuals who were in the classroom with this individual were more than 6 feet away, and therefore they would not require quarantine. So interviewing, there'll be, of course, individuals who were in contact will be interviewed to know who was at less than 6 feet distance and who was in contact for more than 10 minutes and so on, in order for us to identify those close contacts. And those are the individuals that then will be advised the importance of quarantining for the required 14 days. So I think, again, each scenario will vary substantially, but most importantly is that we will move fast to, of course, isolate the case and to do this careful assessment of who is a close contact, who fulfills that definition, and who therefore needs to be quarantined. Other people who don't fulfill that definition, they are quite safe and they don't need to quarantine.
Thank you. We have a question about who was invited back to campus for residential purposes and who wasn't. Melanie, do you want to take that?
Sure. As you know, Columbia has 16 schools and programs, so this differed by school depending on their particular situations. For the undergraduates in Columbia College and the School of Engineering and Applied Sciences, the decision was made for the fall semester to invite back freshmen and sophomores to live on campus, and then students who needed to be on campus in order to academically succeed, so with particular extenuating circumstances. And then if we're not back to normal for the spring semester, that will flip, and then juniors and seniors will be invited back to campus. So it was really to give each group an opportunity for at least one semester of in-person interaction on campus. Other schools have managed it differently depending on their program and the programming requirements and whether or not they're able to provide it online versus needing to have an in-person component for success. But that's where that distinction was made.
Great, thank you. We have a question about the masks, the cloth masks that we showed to you, which are washable and obviously reusable, will be supplemented with masks such as I have when necessary. But the question comes in about them not having any clear panels. So if someone is hard of hearing or they have to project, what will we be doing in order to facilitate that? Wafaa, could you take that? That is actually from
Yes.
our affiliate. Go ahead.
Yes, certainly, and that's of concern. I think the plan, of course, is to provide all the instructors, knowing that the instructor will need to be wearing a mask when they're instructing the students. There will be microphones provided so they can help in projection of their voice. So that's really important, and has been done and has been planned. I think there also have been there has been the option of the masks with the clear front end of the mask, so people can see, can do lip reading. And certainly some individuals and some instructors have indicated that they would like to use those. That's a completely appropriate face covering, we call it, because it's so long as it, again, covers the nose and under the mouth, under the chin. So that certainly is an option for particularly instructors or others who are in the dealing with someone who is hard of hearing or hearing impaired, that they can utilize such face coverings.
We have a question about Mount Sinai Morningside again, and have they been consulted on Columbia's plans? Melanie, to my knowledge, they have not. Again, this is the responsibility of the individual institutions. We would not, I'll speak on behalf of New York Presbyterian Hospital and Columbia Medical Center, we would not have been able to continue to serve our patients who have cancer, who need hip replacements, et cetera, if we hadn't attested to meeting certain conditions. And I would say that Morningside, Mount Sinai Morningside is in the same area, but Melanie, through student health, I don't know if you have a relationship with them and have had any conversations.
Not in terms of kind of consulting in that way. I would say we have a great partnership with them. You know, because we have such robust health services available on campus, and thankfully our need to utilize the hospital is relatively low, even around COVID-19. So we do certainly work in partnership, but in most cases we manage our student cases completely independently of any need for hospital input as well. But we do partner with them around COVID-19 and everything else with our students should there be a need. As well as our wider community, and that is true for any of the hospitals where we refer to.
Great, thank you, Melanie. I'm going to turn to you again. There's a question about where students who do test positive would be isolated on the campus.
Great question. So for our undergraduates, we've actually kept one of our dorm buildings empty for that purpose. So we have an isolation dorm where we can move our students to safely, isolate them. We will be delivering food to them every day, providing them with the medical support, the mental health support, and the academic support that is needed. For our students who aren't part of that residential community, in many cases, as many of us would have to do, they'll be able to isolate in their apartment. If that is not possible, we've already had the conversations with the city about connecting through their tracing program with the city resources around the hotels needed. But in most cases, people can safely isolate in their residence with the appropriate guidance, which we will be providing to them.
Thank you. There's a question about space, and the question is, would Columbia consider providing the community or the public schools with some of the space that might be unused as we see classes being offered online? We're not at that stage yet because we're still, as I said, assessing what students and what faculty are returning. And I think one of the complications is that we are going to have to take a classroom that perhaps held 50 and turned it into a classroom that holds 12. And so that will put some constraints on what we do, but I think this is a takeaway. We'll take it back as a request from the community at large. I want to make a couple comments before we wrap up and I turn it back to Shayla. First of all, the presentation, the slides that we used will be available on the website. Secondly, this is live streamed on YouTube. So if you came in late or you know other people that would like to see it, you can see it on YouTube. And then the third thing that I would say, and I'm sure Shayla is going to touch on this, is that we have had one prior session with a number of folks who are on this event. And we will continue to work with the community as we have more concrete numbers, whether it's around the number of students returning, the number of faculty and staff returning, and what the campus will look like. So we look at the next month as a really important opportunity for us to engage with all of you and with other members of the community. So let me turn it over to Shayla for a wrap up. Thanks, everybody.
Yes, thank you, everybody, to all my colleagues and all of you who have spent the evening with us. We see this as one in a whole series of these types of interactions that will take different forms, and you are certainly invited to contact us individually. There's no question that is too small or narrow or personal. We understand that this is a really intense time for everybody, and there's a lot of fear in what we're talking about, but I think there's also the flip side of this is that we will actually execute this and get 6 months down the road or so, and we will be a relatively normal functioning community again. That's the other side of it. That's certainly what this is all about. It's not just about mitigating risk. It's also about sensibly returning to something that we all miss a lot, and even something better. But I think you'll hear more from us in the coming weeks about more opportunities like this to ask questions, group settings. Like I said, feel free to reach out to us individually. If your different community boards are having gatherings that we can send representation to, please let us know. We have a great COVID site on that's part of our university website, and almost all of this, every policy and rule and everything we send to students, faculty, and staff, all of that is posted on that site in real time. As are these sessions. We link to all of the sessions, these webinars that we do with everyone within our own community, all of the plans that we submit publicly to the state, all of that information will be represented. So take some time to look that site over, and we have a whole frequently asked question function on that. We have a chat bot, everything. There's many different ways to reach us. And I understand that many of you are members of the community. You're also probably affiliates of ours as well. And so we really encourage and need this kind of interaction ourselves, because it really does influence what we do and how we think about it. I saw a number of questions tonight about businesses in the community and how are we going to enforce the student behavior once they walk out the gates. Well, we have a lot of tenants in the neighborhood, and working with those businesses, we can hopefully instill best practices along Broadway and elsewhere. And we're open to many of you have come to us over different circumstances with great ideas in the past, and we're counting on you now to help us figure this out. And like I said, the welcome mat is out. We're not hiding anything. You'll see all of our test results within a few days on the COVID site. So we look forward to more of this, and I thank everybody who's joined us tonight, and you'll be hearing more from us all the time. Thank you. Thanks, everybody.
Thanks, everyone.